tonight I will pose the quiz. I'm going to pose the quiz on 8-point unit what we discussed yesterday. So today we are starting the discussion of 8-point year. Master 2. Definitely we will be discussing more points because recently few more points have been added. Now the number of points are double. Here we have discussed only 8 points. But this time we will be discussing more points. So today we will finish what was given earlier. Then in the next class, means tomorrow, new points given in the year. So year means 99-point unit. So the point 99.01 to be in this way. There are only few points. I will tell you, the 8 points are very much effective. Very, very effective. We have long list. So let's start with the point number 1. The point number 1, which is called ear ring point, that we know are piercing this point. That is called ear ring point, the center of this lobe. As for the master, this point is called 99.01. Point located in the lobe centrally, right? So we can see in this image, this point located in the earlobe in the center, that is called earring point, 99.0 point. The reaction area is 6 vowel. Means all the 6 young organs. As for the master, this point, one of the great points for vomiting and intoxication because of the alcohol. Someone is having any type of the intoxication because of the alcohol, you can add DU25, the point located on the tip of the nose. So DU25 is the point found on the tip of the nose. Very good point for alcohol intoxication or hangover. Even the governing vessel 25 is a very good point for the patient suffering with a psychosis, some psychological disorder, mental disorder, some brain problem. So with that now we are adding earring point. Combination of these 2 points, we can treat any type of the discomfort arising due to the intake of alcohol. 99.01 plus governing vessel 25. Alcohol intoxication. And vomiting. Auricular acupuncture. This point is called the point of eyes. Okay, as per the auricular acupuncture. This point is called the point of eye. Eye is the sense organ. And as per the Dr. Nogia, this has been told the point master sensorial. The master point of all the sense organ, we know how many sense organ we have. We have eyes, we have nose, mouth, ear, 5 sense organ. So for all the 5 sense organ, you can use 99.01. Concept is not given by master. The master tongue, vomiting and any problem because of the intake of alcohol. These 2 concepts given by master tongue. As per the master, ear is being the representation of the entire body, whole body. Doing the imagination of normal imagination. Normal imagination means the head will be here, will be here, will be here. The person sitting is straight. The imagination 1 given by the master to imagination number 2, that is called reverse imagination. Head down position, right? So when the head is coming down here, stimulating 99.01, which is in the earlobe, it is working on the heart center of the brain, central control vomiting, nausea, with the brain. Next point, 99.2. 99.2. First point we discussed, 99.01, it is called ear ring point because we are piercing this point to wear the earring. Now the second point will be bud ear point. Bud ear. Name itself telling bud point. We can see this point located on the back side of the ear. As per the name, it's a very good point for the liver pain, hepatomegaly, fatigue due to liver, any problem which is happening because of the liver. Here exactly this point is located. That's this point. Number 1, we have to go on the posterior side of the ear. Number 2, we have to search one vein, transverse vein. Transverse vein here. Just below the transverse cells is located. I will show you the image of the ear, how this look like. You have to see the transverse blood vessels in the ear, right? I just took this page just now. Look at it. See the ear of someone who is sitting around you. When we are looking the ear from back side, find one transverse vein here. It's very clearly visible when we are looking the ear. I can see the transverse vein here. From there we have to go 0.3 tune down We have to go 0.325. It is coming near about this middle area, just below the transverse beam, wherever it is. So look at here, for this image, it's given, this point is coming near about the mid of ear, mid of exactly at the midpoint of the ear on the back side, but look at the transverse beam. Then you go down, then you will reach on the exact position, and that point will be highly effective. So when we are looking at transverse beam, this is a transverse. I will show you in the other image. You will see live. Okay, so I am showing you the ear. Give me one. Now, I will show you the image of the ear. Look at the ear now. In the ear, we have to go to the back side. Going to the back side, right? Stretching the ear. One, two, to be able to see the transverse beam. Very precisely, you will be able to see the transverse beam here. I see this now? How many person can see the transverse beam here? The middle part here. But what do you have to do? Is anyone able to see? Or you can try on someone, right? Is available. A transverse vein, we have to see in the middle part of here. Below that, and transverse vein is also very important. Shortly we will see the transverse vein is also the point 7 number. been also the point, 7 number point. Right now we are not talking about the 7 number, right now we are talking about the point below that. 3 chun. So this is the 1 chun. So this is the half chun. And 0.3 chun will be this much. We have to drop down from the transverse vein little down. Make sure whenever you are searching the vein, searching the vein in the middle part. You are not going to the some other vein, right? We have to see the location of brain in this middle part. We will be seeing this vein. This is a very important point. In the future, we will discuss this, the 99.07. But right now, this is not our target. Our target is the point which is lower, that is 99.02, which is the very good liver point. Create instant results, immediate results. Person is having hepatomegaly, due to the liver problems, excellent point. Good ear. We can consider this point is near about exactly in the middle, right? That's what he told me. If we make the axis, then upper point is the heart, point is the liver, lower point is the kidney. The Mashadum, in the upper part we are getting the point of heart. In the middle part we will be getting on the back side the point of liver. The lower part we are getting the point of kidney. This concept is given by Master. So exactly in the center, in the middle of the ear, you find this point, which is 99.02, or the good ear or the liver point. Let's move to the point number 3. Now we are following the same concept. The upper point is heart, point is the back side, that is liver, and the lower point is kidney. So let's see the point heart and kidney. Heart and kidney are very much important. The relationship of the heart and kidney is very much important, because if we improve this relationship, definitely we'll able to improve the heart, we'll able to improve the kidney, but the most important thing, immediately the chest pain will go away. So the location of these 2 points, and immediately back pain will go away. Kidney deficiency will go away, the knee pain will go away as soon as you put the point heart and knee. So let's discuss the heart point first. Already know the location of Shenman. So know Shenman. How many persons are aware with the Shenman? The location of Shen. So this is the location of Shenman that we know. Shenman is here. So the Shenman is the point found in the triangular fossa. And in the upper part of the triangular fossa, in the corner, that is a Steinmann. And what is this? This is anti-helix. This is anti-helix, right? Now, to target the Steinmann, to the point on the anti-helix here, you can consider we are trying to put the Steinmann point not inside the triangular fossa, outside the triangular fossa, where on the anti-helix. This is the master to heart point. The number is 99.03. It will improve the heart immediately. So how to search this point again? So you have to look at the Steinmann. And just above the Steinmann, this point is located. Just above the Steinmann, this point is, right? Okay, I will tell you the effectiveness of this point. I have tried this point for many persons having chest pain. Just I applied auricular seed on the right side because we know that we are putting the mastering point on the opposite side. Immediately chest pain gone. Immediate. We all know master to treat the heart, we will able to treat the knee. You see the result in the knee immediately. Knee of the opposite side. Immediate, very effective. Went to Ahmedabad. One artist came that he told, I have not slept many days, having chest pain. I applied this point and he kept this point for 3 days. He told after even after removing the point also he didn't get the chest pain. During the traveling, my journey, at this point, single seed. We've seen the good results. Only one side. If the person is suffering with a heart pain, and one side, if the person is suffering with a kidney pain, if the person is suffering with a knee pain, knee, then we have to add kidney point also. The kidney point and make the wonderful combination. So where is the kidney point? I will show you now, 1 minute. Okay, look at this image. As for the auricular acupuncture, we know the location of neck. So this is the helix. And this is the location of neck. that we already know. And this is anti-helix, right? Anti-helix can be divided in so this is the crus, superior and inferior crus of the anti-helix. The body of anti-helix, the tail of anti-helix, the lowermost part. Just imagine the anti-helix is the entire body. The anti-helix is the entire body. So we are taking the heart point here, kidney point exactly at the end, but outside border. Kidney point. 99.06 and this is the 99.03 in the kidney. Single point, you will see wonderful results in the knee pain, lower back pain, in the kidney deficiency, the night. Any problem happening because of the kidney deficiency? Combine both the point. Someone is suffering with the knee pain, combine both the point opposite side. Enough. Just apply seeds and tell the patient keep it for 7-8 hours or 4 hours, many days. This is the point that is called kidney point, which is connected with the lower back pain, bilateral lower back pain, knee pain, and the eyes, because the blurred vision, the problem of the eye is connected with the kidney. And look at the heart point first. So the upper is the point of the heart. Heart failure, knee pain, limb pain, like pain in the limbs, arm and leg. Then I told you, the kidney point. The outer border of the anti-helix at the lower end. Number one, lower end. Remember lower end. To outer border. Do not forget outer border because you have to be on the border. Don't forget to touch the anti-helix. You have to put the point in the way that you are on the border of anti-helix. It's a very good point for deficiency of the kidney. Pain at lower back on both sides, even abdominal distension, even the problem of eyes, because eyes connected with the kidney. Point, wonderful. Try at this point. Person just apply the seeds. When someone is telling I'm suffering with a chest pain, I apply this point for full confidence. Oh, I know that as soon as I will apply this point, chest pain will go. Definitely will. Pain will go away 100%. Back pain will either go away or will reduce. Knee pain either will go away or reduce significantly. Applying this point, only the one patient will tell you that I'm not getting benefit who is taking steroids, having very, very sluggish metabolism. So nothing is working fast. But I will show you again in the other image because the location is very easy to find. With the point once again. So this is the triangular fossa. We don't have to put the point inside the triangular fossa. Inside the triangular fossa we have our Shannon, right? This point is located outside. So the upper point is outside. Our 99.03 point is over the anti-helix, not inside the triangular fossa, but just next to Shannon. And when this is ending, at the border we are having 99.06, the point of K. 2 point, wonderful. How many person will be able to apply? Person will forget this point immediately after the class. Will you forget? Don't forget. There are too many points. How many remember? For the knee, there are too many points. Very good point, right? Will apply. Apply this. Apply this today, tomorrow, for 2 days. Whenever you get any patient getting some problem with the heart, problem of the knee, back, just apply these 2 points on the opposite side and see the results. Let's move. So now we will be looking at another point. This point is very, very important. We already know the location of a spleen in the auricular acupuncture. What is the location of a spleen in the auricular acupuncture? We know that. So this is the same location. And the reaction area also, the spleen, Masterton told 99.04. And we know the spleen is equal to the pancreas. So this point is one of the great points for diabetes. Very good point for diabetes. But remember spleen. What is the emotion of spleen? Tell me. Is the emotion of spleen. If someone is having worry because of the rate of income tax, too much worry. After you have done the corruption, you know that someone will caught. You are not in the safe zone. You're always thinking for what will happen, what will happen. If the person is having that type of the severe form of the worry or anxiety, we will see swelling over the 99.04. Swollen, like mosquito bite. We know when the mosquito is biting, how we see the swollen area. I've seen one patient. Did the mosquito bite here? No, nothing. Oh. Then I asked, yeah. Then I checked the pulse. Pulse was missing pulse. Missing pulse means after certain beats like dub, 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 one pulse is missing. I asked her, do you have some worry? Yes. The person did some corruption. Just on the next day or after 2-3 days, preparation that will go to the gym. He was having too much worry. Right? When you are worrying a lot, the immediate change on the 99.04. 99.04 point is the point connected to the spleen. Let's see this. Point 1 second. Let's see the location of this point. The point. The point below the point of his spleen. 99.04. With overthinking, worry, mental emotional problems, for the master student, this is the point of diabetes. As for the master student, this is the point who will control the sugar. This point is much useful. We know that spleen is responsible for making the hemoglobin, blood cells, one condition that is called polycythemia vera. The polycythemia vera is the condition when hemoglobin is very high, maybe 90 plus. This is the point to treat the polycythemia vera. There are not many points in the for polycythemia vera. These you can work as per the symptom, as per the term diagnosis, but you see the polycythemia vera term, it's very at very few locations. This is the point good for polycythemia vera. What will happen if your hemoglobin is higher than the 18? What will happen? If your hemoglobin is too high, 90 or the 90 plus, it means blood is very thick. Blood is very thick, skin will become black. Skin start becoming black. Finger will start becoming stiff. More concentration, blood is not good. Neither the less nor the more, blood is good. If there is too much hemoglobin, it means it will create higher density. Food or the fingers or the face will start becoming blackish. With a stiffness in the body and the finger. Doctor telling, okay, donate the blood frequently. Then these people are donating the blood. Still, that is not enough to maintain their health. Suffering with lots of uneasiness and discomfort. Yes, polycythemia vera. And we know the chances to make the clots, yes, right? So, see, what is blood? Blood means the combination of RBC, WBC, platelet, hemoglobin, more RBC. They might create somewhere. They might form clog. So when the patient going to the doctor, they are prescribed blood thinner, right? Because now we have to maintain we have to keep the blood thin, otherwise it will create the problem. A great point for high fever. I tried this point for high fever. It's working very nice. High fever. In the high fever, so you will see the swelling here. This point will become swollen in the high fever. So this is the point, 99.0. $99.04. So 99.04 point. Very good for polycythemia vera, diabetes, high fever, neurasthenia, mental emotional issues,